About a year and a half ago, we shared some startling statistics about how people having heart attacks were arriving at the hospital. 40% had someone drive them there instead of calling for an ambulance, and that is one of the worst things you can do. So hospitals here and across the country began a huge project aimed at reducing the time from heart attack to treatment. Is it working? Dr. Michael Lim is the president-elect of the St. Louis chapter of the American Heart Association, director of the Division of Cardiology at St. Louis University Medical Center. You're just back from the American Heart Association meeting in Chicago, where you say it was cold.
It was cold.
Thanks so much for coming to join us here on First at 4. So the national numbers really aren't being released until tomorrow, but you're here with a preview, able to share some of the results on First at 4. Are more people calling 911?
So for the first time, we have 17 hospitals in this area that have all banded together to say we need to treat heart attack better. And so in looking at that, we can find that only about 35% of people now are driving themselves in. 65% are utilizing the ambulances in the 911 system. So it looks a little bit better. The better news is that if we look at how people do in this area, the mortality rate, which is unfortunately the number of people who die in the hospital from a heart attack, is 5.7% in this region, compared to 6.4% nationwide. So we're doing a little better than across the country, and so that's phenomenal.
So is that attributed to the fact that maybe more people are calling an ambulance instead of having somebody, God forbid, drive them to the hospital?
So part of the problem is confidence in, well, if I call 911, where are they going to take me? And so the assurance that we can give you now is that all 17 hospitals that treat heart attacks, we're all in it together, and we're all into trying to take care of people as fast as possible. And in fact, the data actually also show that your treatment for your heart attack will be at least 15 minutes faster if you come by ambulance, because right now in this area, they can call me when they're picking you up, and I can be coming into the hospital the same time as you are, thereby we get your treatment done faster and you're going to do better.
And what are some other reasons people should call 911? Because I mean, I think some people do think it's faster, but there's more. Is there more that can be done in an ambulance?
Absolutely, because a heart attack doesn't necessarily always represent a stable situation. And so sometimes we can go into bad heart rhythms, and we need to get those electric shocks and CPR delivered. Those can be done by our trained folks who work in all the EMS systems across the region, and they're very good at it. So they diagnose the heart attack faster, they start treating it faster, and they can help you if you have complications from that heart attack. So you're going to do better. So call 911.
Can you address this issue about aspirin? I think so many people have been taking that daily aspirin. Should everyone continue to do that?
So the data with respect to prevention is very hard to tease out. Certainly if you've had heart disease, like a blockage in one of your blood vessels to your heart, or you've had a heart attack before, the daily aspirin I still believe is a very good thing. However, primary prevention, meaning you haven't had one yet, maybe your parents had a heart attack or your uncles, that type of thing, and you want to avoid it, aspirin is not completely safe. So it does increase your risk for bleeding. And so we have to weigh risks and balances with respect to, is something working or is something causing harm? The risk and balance comes a little bit closer to even when we haven't had a heart attack or an event before, but markedly favors take it if you have. And so you need to talk about that with your individual physician and ask that question, because it's a person-by-person decision.
All right, Dr. Michael Lim from St. Louis University, thank you so much for coming and sharing this new data from the American Heart Association, and congratulations on being the president-elect.
More to come.
All right, sounds great. Thank you for joining us. Cindy's in the First Alert Weather Center.